This is a patient with an axial length of 19.27, anterior chamber depth of 2.46, lens thickness of 5.05, requiring a 37 diopter lens. You can also see some posterior synechii. I create a paracentesis. I'm using dispersive viscoelastic to release the adhesions, and I do the paracentesis on the other side, and again release the adhesions. It's important that the iris is fully free from the anterior capsule, and you can see that the pupil is now round again. I do prefer iris hooks in a diamond configuration in shallow anterior chamber depths. I prefer nicking the conjunctival vessels, and you can see that once all four iris hooks are in, we create that diamond configuration. You can see an early white cataract formation here. Now with capsulorhexis, it is at risk of running out because this is a very small eye, small anterior chamber depth, and the lens thickness is very large. So the take-home point for this step is copious amounts of viscoelastic. I do this actually 3 times. That was the second time. And as I go along this quadrant here, again, more viscoelastic to flatten the anterior capsule. And here we are able to finish with a well-sized capsulorhexis. Hydrodissection is uneventful. As you can see with phaco here, we're dealing with a, as you'll see, a white fluffy cataract, so fairly easy to remove. This step is uneventful, but I will highlight something later on about phaco and IA. But overall, fairly quick and straightforward for these 2 steps. And this is the power. So it's a 37 diopter SA60-18. Now this is a 1-piece lens. I recommend overfilling the bag. This is a very large lens in a small eye. And you want to take your time as the lens unfolds. And the next step here is to remove the iris hooks. And then remove viscoelastic, hydrate the incisions, and that's the end of the case. So a couple of things I wanted to mention that are maybe a little bit more hard to appreciate on video is with these very small eyes, sometimes they are at risk of aqueous misdirection. And I did notice a bit of that during phacoemulsification and IA. It's very important that you notice that because the capsular bag will come up even with infusion. And so you want to be cognizant of that. Sometimes you want to adjust your settings, sometimes lowering the bottle height. These cases are also at risk for IFIS. This unfortunately did not happen here. And as I mentioned, the lens that we're using is a 37 diopter lens. So this is a 1-piece lens. My backup 3-piece lens does not go up that high. So if there was any violation of the bag, that would be an issue because you can't put this 1-piece lens anywhere else but the bag, and you'd have to stick to using a 3-piece lens. So when you're dealing with a small eye and you're putting in a very large sized or large powered lens, you want to overfill the bag because you want to limit any potential contact between the lens and the bag. And as I said, it is ever so important to maintain the bag. So anyways, those are some take-home points from this case. I hope you found it to be useful.